Good afternoon, folks. This is Robert Chapo, Executive Editor of Madison365, with your daily update for Friday, September 10th. The update today is brought to you by Forward Theater Company, presenting Mom, How Did You Meet the Beatles? By legendary American playwright Adrienne Kennedy and her son, Adam P. Kennedy. This autobiographical experience is a personal account of Miss Kennedy, who was hired to write a stage version of John Lennon's new book in 1960s London. It's a story about holding artistic ground in the patriarchal world of show business, presented in the Playhouse at Overture Center September 9th through the 26th. It opened last night, so you can still get in tonight or through the 26th. Tickets at forwardtheater.com, and we appreciate Forward Theater's support of Madison 365 and of the update. So here's what we have for you today. It's a mixed bag on the COVID front. Let's talk through the numbers first, and then we'll talk about the federal government stuff. We talked a little bit about what we knew at the time when I was talking to you yesterday, earlier in the day, and then President Biden spoke yesterday afternoon, laid out a whole host of vaccine requirements and stuff. We'll just talk through briefly. You probably are aware of at least some of them, but we'll talk through them real quick. And if you have any questions about those, drop them in the comments. And then we'll talk a little bit about mu variant, because we touched on that the other day, and I have some updated information for you. So cases today are up significantly for the day, 2,350 today. That's the most in a single day we've seen in a while. But because I think partly because we're still like the holiday weekend is still looming in the 7-day data, our number of cases per day on average is actually down from yesterday even to 1,538. That'll climb back up starting Monday, probably, just because the holiday weekend is still in that 7-day window that we have right now. The other piece of not very good news is that our new death reported are now 13 on average per day. That's the highest that's been in a long time. That's the highest that's been since January, probably. 24 new deaths yesterday. The day before yesterday was 32 deaths. Now, again, these are not deaths that are happening right now. These are deaths that are being reported right now that happened in the past 2 to 4 weeks, probably. Right. So we saw our surge in cases, started sort of mid-July. It started to go up, and the case, the positive test rate, which we'll talk about again in a minute, was going up through the month of July. So just now we're starting to see the resulting deaths from that, because it takes a couple of weeks just for the disease to run its course. For somebody who gets sick and then goes to the hospital and then dies, takes 2 to 3 weeks. Although there's some indication that Delta is actually killing people faster, which is kind of grim to think about. But in any case, it still takes, then even after a person passes away with COVID, it takes another couple of weeks to certify that and confirm that was the cause of death. I get that into the data. So we aren't going to see a big surge in deaths until probably even mid-October. But it's starting now. It's starting, because the deaths are starting to ramp up now as a result of that increase in cases in July. Okay, we don't know how high it's going to get. We're still kind of ahead of where we were last year. Last year on this time, we were kind of in the 6 to 7 per day range. Now we're at 13. So we'll cross our fingers that doesn't get worse. Now, to some better news. Positive test rate fell again to 7.7%. That's still way too high. It still should be below 3. Right? This is of all the tests in the past 7 days, which, by the way, we're still doing a lot of testing. Even though you don't see the big community testing sites, there are a lot of groups of people who are getting tested every day, or at least every week. So we're still doing like 20, 25,000 tests a day. And of those, of the past 7 days, 7.7% have been positive, which is way too high. But yesterday it was 7.9. The day before that was 8.4, right? So 2 days in a row it went down. I think it'll probably go back up soon, although we are seeing a national trend slightly downward. I'm not sure what to on in both cases and in positive test rate. The nationwide trend right now over the past week is downward, which is great news. I'm not sure why. I think it might be just a response. Like people are, this happens, right? Things get bad, and then people start to behave differently, and things slow down a little bit. Might also be just vaccines continue to go up. People are getting vaccinated. So I would not be shocked if that positive test rate continues to drop and gets back down in the 5% range, over the next few weeks. I also wouldn't be shocked if this is a momentary dip and it starts to go back up again. Or if it kind of plateaus around 7, which is kind of where it got stuck a couple of weeks ago. So, again, it's difficult to predict. We'll keep our fingers crossed that it continues to go down. The other bit of decent news is on the hospitalization front, which is even within hospitalizations, we have kind of a mixed bag today. The total hospitalized population right now is 1,047. That's a decrease of 24 from yesterday. So that's good news. That is good news, assuming that it's people being discharged and not dying. Right? I hate to rain on the parade of decent news. But the mixed bag comes when you look at the ICU population. That actually went up by 5. So of those 1,047 people currently hospitalized, 322 are in ICUs. Now, the total hospital population, even though it went down for today, it's still significantly higher than it was a week ago. It's 69 higher than it was a week ago, roughly 5%, a little over 5% of what it was a week ago. And the same is true of the ICU population. Now, we did get a press release. I'll see if I can find it here from SSM Health. Not from SSM Health. From the South Central Wisconsin Hospital Emergency Response Coalition, of which SSM Health is a member. So this press release came from SSM Health to me, but it's on behalf of the South Central Wisconsin Hospital Emergency Response Coalition, and it says that the South Central Wisconsin hospitals are stretched thin. It's putting a strain on resources. This serious situation is occurring across the 14 counties of the South Central Wisconsin Healthcare Emergency Readiness Coalition. Its member hospitals are asking for our community's help, urging everybody to get vaccinated, to mask up, to stay home if they can. From in the South Central region, from July 28th to September 1st, that's just that July-August time period, the total number of COVID-19 hospitalizations increased fourfold, 400% in the South Central region. And the ICU hospitalizations went up by 550%, 5.5 times higher. So that's, putting a significant strain on resources, even in South Central Wisconsin, where Dane County is, and Dane County is doing okay, right? The rest of the surrounding counties, not so much. So that's the hospitalization picture, even though it is slightly better today, or I should say, at least it's not worse today. It's still not good. We're still well ahead of where we were this time last year. Now, it's possible that we'll peak in October and start going back down rather than November. If we peak in November, like we did last year, it's going to be very bad, because we're, by the time we get to mid-October, we're going to be where we were in mid-November last year, which was almost 2,300 people hospitalized. I would predict that there will be over 2,000 people hospitalized by mid-October, and if that's the peak and it goes back down, fine. If that's not the peak and it continues to go up, that's going to be very bad for the winter. So again, cross your fingers, but don't just cross your fingers. Get your vaccine. right? This isn't something we just have to sit and watch and hope. This is something we have some control over. We can get vaccinated. We can get our family members vaccinated. We can, hopefully by November, we can start to get our kids vaccinated. That would be nice. And we can also continue to mask up. So that's the numbers. Again, if you have any questions, drop them in the comments. The We'll talk a bit about this federal response. The president laid out, like we talked about yesterday, that was kind of leaked beforehand. All federal employees must be vaccinated. It's not real clear when that takes effect, but soon. Um, and there's no testing option, right? It used to be a month or so ago they announced that all federal employees had to either get vaccinated or uh, test every week. That is no longer the case. Now it's you have to be vaccinated, period. Additionally, any employer with more than 100 employees, so that covers about 2/3 of the workforce, must require their employees to be vaccinated or test weekly. So the employer piece, this is the Department of Labor is going to impose this rule on employers that they do have the option to either be vaccinated or test weekly. And the employers have to give people paid time off to get vaccinated, which is that's a big piece of this. Kind of got overlooked in a lot of the coverage, but that's going to allow people who have a hard time getting vaccinated to do it, to take that day off of work to recover with any side effects, or even just to make it to an appointment, right? So if companies fail to do that, it could be fined up to $14,000 per violation. The other thing is all healthcare facilities and healthcare organizations that receive Medicare or Medicaid, which is basically all of them, must require all of their staff to be vaccinated. And all agencies that provide Head Start services, all the educators in the federal Head Start program will be required to be vaccinated. So, this is going to be, and the thing is, like, of those populations, most of them are mostly vaccinated, except for maybe the employer piece. Right, 70% of the country is vaccinated, at least partially, has at least gotten started. So I think this will get it over the finish line to that 80% herd immunity, whatever. Because I think, as I've said before, I think a lot of this is a lot of the lack of vaccination has been complacency rather than opposition, right? The opposition is very vocal, so you hear about it a lot. So it sounds, if you go on Twitter and Facebook some days, it sounds like everybody in the entire world hates being vaccinated, but really that's a relatively small number of people who would just make a lot of noise. I think most of the vaccine, what we have to make up for in the vaccine is just people who haven't got around to it, who didn't feel it was important, who didn't want to, it was just inconvenient, didn't want to take that time off work, who didn't want to make the appointment, whatever. It's like, oh, I'll get it next week, and then next week comes up and you got stuff to do and you just don't do it. So I think these requirements will get those folks caught up, but also it takes there's a lot of peer pressure in some, like, anti-vax communities. There's peer pressure to not get vaccinated, and now you can say, like, I'm with you, I'm anti-vax too, but it's the law now, so I'm going to go do it. And your employer, who might have been hesitant to require a vaccine for whatever reason, it's out of their hands now, and like it's the federal government is the bad guy now, making everybody get vaccinated. So for all those reasons, I think it will work. I think most people, even though it's going to be difficult to enforce, but I think a lot of people are just rule followers. A lot of people, you say it's required, they're gonna be like, okay, I get it, it's required, I'll do it. right? So I think it's mostly good news on that front. Now, one last thing, we talked a little bit last week, or earlier this week rather, about the mu variant, and there was some concern um, about that variant, which has gotten a couple of headlines. Now, a couple of things I want to say about variants, if you'll stick with me for a second. Um, I think there's kind of an assumption that every new variant is worse than the previous variant, and that's just not the case. Just because there's a new variant doesn't mean it's worse. Okay, a change is just a change. A mutation is just a mutation. It doesn't necessarily mean it's worse or better or even that much different in terms of how it affects people. It's just a different strain of the virus. You know, influenza A. There's every year there's an influenza A, and influenza B, and influenza C, and like A, B, and C are not, one's not necessarily worse than the other. So we actually have now alpha, beta, gamma, delta, eta, iota, kappa, lambda, and mu. Those are all variants out there right now. You've never heard of eta, iota, kappa, or lambda, have you? But they're out there. They've been identified. Um, there's even been some iota in Wisconsin, but it's just no worse than alpha. It's just different chemically, genetically different, but it's not worse. Delta, beta was slightly worse than alpha. Delta is way worse than all of them, right? Worse in terms of more communicable, not necessarily. In some cases, worse in terms of severity in the individual, but definitely worse in terms of transmissibility and communicability. So with that in mind, for the past, this variant report is in fact, why don't I'm just going to show this to you. Let's see if I can make this work. I hope this can look decent. It doesn't look great on your screen, but you see that dark red, that sort of dark purple here on the right hand side. That's delta, and this lighter pink is alpha. This little purple down here at the bottom, this light purple, is iota, and these, I don't know, you probably can't even see them if you're looking at this on a phone. You can't even see these tiny little dark purple spots down here. That's mu. So basically, right now, it is all delta all the time. Literally, the past 4 weeks, 100%. 1, 2, 3. The last 3 weeks, 100% of all the samples sequenced were delta, and the week before that was 99%. So basically, all delta. Mu variant, we're looking at, there were 5 weeks ago. Now, again, this wasn't reported 5 weeks ago. These were samples taken 5 weeks ago, which were then sequenced. So we didn't know this until yesterday. But 5 weeks ago, there were 14 cases of mu. The week before that, there were 7. 3 the week before that. 2 the week before that. So we're looking at, about probably a total of 25 or 30 cases of mu variant. Now, this is of concern because there's been a lot of talk about mu variant as if it's going to be resistant to vaccines or worse than delta. In that, having done a little bit of reading on this, not being an expert, so don't, this is not scientific opinion. This is like, I've read a few articles and some both sort of academic and news articles, that it doesn't seem like mu is worse than delta in any way. It has become 39% of all cases in Colombia, right? And it obviously is in the United States. It's in Wisconsin because that's how viruses work. They travel worldwide no matter what you do, right? Especially when it's transmissible as it's coronavirus. But it doesn't seem like mu, like nobody at the federal level, or even World Health Organization, or CDC, or academic epidemiologist types are terribly worried about mu. Because it doesn't seem to be worse than delta, generally speaking. It's just notable in how it's really taken hold, as kind of taken over a large proportion of the cases in Colombia. But that's just in Colombia. It's a large proportion of the cases. It doesn't necessarily mean that it's worse than delta. Now, again, we also heard at one point that Delta wasn't worse than Beta. So, grain of salt there. But I was significantly worried when I heard that Mu had landed in Wisconsin. Did some reading. I'm less worried now. But also, it's good news that the state is keeping track of it and watching it. And once a week, we will get an update and we'll know whether Mu variant starts to take over for Delta variant. So far, it hasn't. Delta variant is bad enough. Thank you. We don't need more variants being worse. Okay, so thank you for your attention. That's all I have for you today. I hope you have a wonderful weekend. Get out and enjoy it. It sounds like it's going to be a really nice weekend. I will be coaching some soccer tomorrow. I'll be watching some more soccer tomorrow night. And on Sunday, it's going to be a soccer heavy weekend for me. I hope you have a good one though. Find some stuff to do with people you love. Take care of each other. Take care of yourselves. And we will all get through this whole thing together eventually. All right. Have a great weekend. We'll see you Monday.
This is 365 Media.